Hello, Dr. Kiran here. That patient suffered a fracture of the radial head, which is not so round actually. The shape is something ovoid, but it has a safe zone, and a safe zone is an area where is non-articular. So we can put some plates or screws, no problem. But we cannot put a plate or screw wherever we want. Remember this. This is a very important point. And this patient, when he had a fracture, 30% or more than that was a single fragment. When there is a fracture of the radial head, Mason has said there are three types of classifications. One is a non-displaced, just a crack fracture but no displacement. Second is a displaced fracture. Three is displaced and also with a comminution. Now modifications were added. What is this? Sex low prestige fracture? What is it? It is the same fracture with the introsseous membrane also ruptured, so there will be instability of the radius. The radius may move up and down. So if you bell out it and see, you can notice the contusion, everything, hematoma, everything will tell you. The wrist pain, everything are indications of a more severe injury than just a radial head fracture. Now this patient finally came. What I did, which we know we can do it, not mentioned here, because in the treatment of radial head fractures, if it's undisplaced, just put a brace or a cast, and if it is within acceptable displacement, also cast. Otherwise you can just excise the fragment, resection. And third is replacement with what? With a process. Now 31 years, gentlemen, if you want to excise the whole head, just because only 30% was fractured, why should you excise the whole head of the radius? Remove it, put a new one. Why? This is my question. So what I did was, I took a piece from the pelvic bone and put it there and fixed it with a screw. He had wonderful results. This is a message to all my colleagues and also especially the young students. We are all running after joint replacements, arthroscopy, artificial intelligence, robotics. You do all that. Don't forget your basics. Bone grafting was always having a place. This is what I did. I did nothing great. For a 31 years young man, if you replace with a process, won't it need a replacement? Maybe it will become loose. Maybe so many things can happen. So why can't it be the last option? This is only what I say. Let's go to the Google Meet between me and Mukesh Kumar Yadav. Can I know your story?
My name is Mukesh Yadav.
Yes.
And I'm from Varanasi. My age is 32 years.
Okay.
I was playing cricket in July last year. I fractured my hand plus leg also.
So you had an ACL tear, isn't it?
Yeah. In emergency, I went there one hospital. It is nearby my house and it's very famous hospital in Bangalore. They perform both the surgery. First, they actually performed the surgery on my hand. They removed that fraction, whatever I have sent you already. On the next day, they did my ACL reconstruction.
Okay.
I got discharged. Then they started my physiotherapy. In physiotherapy, I was going for physiotherapy more for my hand because it was very stiff after that.
For the elbow.
I was not able to basically, for the elbow movement, I was not able to even go for a little bit stretch. So they suggested that you have to go for the physiotherapy. Once I started physiotherapy, suddenly I felt instability in my hand. Yeah, in and out. So I went there. And he said that it shouldn't happen. The doctor said that it shouldn't happen. It is unfortunate that this is happening. What we'll do, we'll wait for 2 months and they basically cut the radial head. But I waited for 2 months.
We call it radial head excision.
I waited for 2 months and it was day by day. It was. I was getting more instability, not the stability. I was getting more instability and my hand was swelling when I tried to move my hand. Then I got to know that there is no improvement. Then I went there and he suggested same thing. The doctor suggested same thing. So I wanted to have another opinion because it was failed surgery. So I went to hospital in Bangalore. It's also a very famous corporate hospital. There they suggested that you have there is one band which holds the
annular ligament.
Annular ligament. Sorry. So they said that you have to reconstruct the annular ligament. then there is a chances, it's not guaranteed, there is a chances that you will gain the stability, but the problem, they said that your hand will be limited to 30% up and down, only 30% movement you will have in your hand, because they will basically tighten all the ligament. After that you will have that many much movement only. Then I was not satisfied. I went ahead and visited multiple other doctors, and one of the doctor in replaced it with the with the synthetic radial head.
Prosthesis, radial head processes.
In that stage, I started talking to you.
How did you find me? It's very interesting the way we both met each other.
Yeah. So basically, at that time I was very frustrated, and basically I was not having any hope. So I was searching for the resource on YouTube, and I saw one video of a girl. She was having the same kind of conditions. Her radial head was going up and down. So I saw a little bit familiarity with my case, but the case was, in my case, my radial head was partially removed. But in her case, it was not removed. But I thought that it's something similar I found, and I searched for who was the surgeon. Then I went ahead and checked the YouTube channel. There I found nothing. Basically, it was written Dr. NVS Kiran, and then I was hopeless because I was not finding any phone number, nothing. So I went ahead on LinkedIn and searched for the name, multiple combination. Then I found that this is the profile.
Yes.
Yeah, on LinkedIn I found the profile. Then I sent the connection request, plus I sent an extra message also that, sir, I am having this condition and I am trying to connect you, but I am not able to connect you because I don't have your number. And luckily you replied.
I always reply because I really want telemedicine, consultation to be more popular. Because we can reach strangers, just like I met you, you met me. Also, opinions can be shared and discussed.
Yes.
So what happened? What did I tell you?
Dear, your case is little bit different from what you have seen on the YouTube, and then you basically asked for every detail whatever I had for my hand. And I shared everything, the image, the MRI, then everything I shared with you. In between, what I was doing, I was going in Delhi, I went. And,
Delhi?
Yeah.
Okay.
So, Gurgaon and Delhi, but I found out that they are suggesting the same thing. Whatever I was hearing, that either we can go for ligament reconstruction.
Lateral collateral ligament or the ulnar collateral ligament reconstruction.
Yeah, so he suggested that. Then again he said that there is no guarantee that you will get the stability. There is luck, 50% chance that you will get the stability. So I was afraid. I was talking to you also, and you came back with one solution, and you explained me very beautifully that there is a ring, the cup and saucer thing.
Yes. Yes. The wheel must be complete. Otherwise, the wheel will be jumping each time we start cycling. So that defect in the head should be reconstructed.
That explanation basically helped me. Something I heard new basically that time. Someone is explaining it in a way that I can understand.
Thank you.
You said then you come back with one solution that will remove one fraction of bone from your hip side.
Yes, pelvis.
Yeah, will remove and will complete the circle of your radial head. Then it will be like refurbished elbow.
Exact word, yes, I used, yes.
Yeah, then you will have the refurbished elbow. It's not new, but it's refurbished. You will have everything, whatever you had earlier. So then also basically it was very difficult decision to take. Correct. Because I met other doctors who were not agreeing on your solution also. You should go for the basically prosthetic and you should go for removal. They are more of line on those lines, and I found out that those solution is not for the longer duration. Given my age is 32 years, and they were saying that you have to do again this procedure after 15 years or say. Yeah.
That is the point what I was trying to emphasize when you contacted me. At my age, I'm 57 and a half now years. So I don't mind having an artificial joint. Okay, but I don't want a 31 years young man, just same age like my son, to have a synthetic one there. I told you some things. I told you it can cause failures, loosening, synovitis, many other things. So why not we reconstruct the whole wheel and see if it fails due to lack of blood supply? It's different story. Then you can go back to the everybody's advice of process replacement. And fortunately you agreed, and now the surgery was done. How many months now?
It's been 3 months.
Can you show us how your movements are?
So almost.
Get your elbow down a little. Now make it straight as much. Oh my God, that's good. And fold it. Fold it. Oh, fantastic. And can you do the rotations, please? Yeah, ऐसे ही रखना. इसको don't do this. Keep it straight and just do the rotations.
Okay. Yeah. So I'll just adjust my camera and
yeah.
So now I can rotate fully.
No instability.
No instability.
Any arthritis may come. Any pain there when you're doing light
no,
pain?
Pain is not there.
Pain is not.
No.
And no instability.
No.
This calls for a celebration, because every surgeon, my parting advice, opinion is, no surgeon wants to leave anything which damages the patient. It just happens sometimes. But I'm happy you got a good result. Opinions vary because maybe everybody is right. So I will always say, my message to the juniors is, never discard what you should first fix. There is no shame if I do it and it fails. The same interview would have been different from your side. You would have said, doctor, I didn't get relief.
Yeah.
So it's a human nature. But no doctor I know is less well-read. What you mentioned are the best institutes of India. So I'm fortunate that we met. It's all destiny of God. So what is your parting advice to young doctors as well as patients?
I would say, sir, everyone body is precious, and if anything is broken, we should try to basically manage it to repair it. We should not be discarding something
with the patient's own body part.
Yes.
Actually, radial head excision is a proven, documented advice for radial head fractures. So it just depends on it's like a debate. You debate for and against. But I will always say the normal anatomy must be restored. Okay, if the blood supply is lost, anyway it will not stand, then you go for the second surgery instead of leaving it. Because it's a learning curve, Mukesh. It's a learning curve. Like even doctors, we change our options, The options which I was making when I just finished my post-graduation and the options I'm making now at my age of 57 years are totally different. So God bless you.
Everything we are going to remove, we just give the second thought.
Excellent. This is the message I want to give to all my juniors who are watching in the International Research Training Program. Please, arthroplasties, knee arthroscopy, or some spine surgeries, foot surgeries, everything are very important, but don't forget the basics, where we do all these kind of rehabilitative surgeries. Everyone must master. So you are very happy with this surgery which I did for you?
I am very grateful to you, sir, that I met you, because I can be sure that I don't need any surgery in coming years. In that way, the day I put it the prosthetic, I was counting, oh my God, 15 years is coming back, 15 years coming back. That is the little bit anxiety every time you...
Yes, any process will have to have a revision sometimes. Because earlier the age of the process application, the sure will be the chance of a replacement, which I wanted to avoid. So
Yeah.
thank you for your beautiful conversation. A very noble man you are. God bless you. Chalo.
Thank you, sir. Thank you.
Bye bye.